This is an example of a BIPAP machine. And here's a BIPAP mask that has a pressure release valve as a safety feature and opens when excess of pressure builds up in the mask to allow the patient to breathe environmental air. This is a fitting wheel that is used to determine the optimal face mask size for the patient. It fits over the bridge of the nose and you want to cover the entire mouth. Here the mask is being connected to the patient with a head strap. The optimal patient for bilevel positive airway pressure ventilation is an alert, cooperative patient who has minimal secretions. Here the head strap is being fastened to the face mask on the right side, as is demonstrated here. Now the top portion of the mask will be attached to the head strap. This top portion can have fine adjustments in or out, up or down to optimize patient comfort. Here the BIPAP tubing is connected to the patient with the carbon dioxide release valve away from the patient. The initial BIPAP settings are an inspiratory positive airway pressure, or IPAP, of 10 and an expiratory positive airway pressure, or EPAP, of 5. An initial respiratory rate with a minimum rate of 4. These are actual values that you see here. Now you see that the patient is breathing with a tidal volume of 1,200 milliliters, a minute ventilation of 15 liters per minute, and a peak inspiratory pressure measured at 11 centimeters of water. You also see a small air leak of 5 liters a minute, which is negligible. We can now increase the inspiratory time. Increasing the inspiratory time will improve oxygenation. You can see the patient is tolerating the BIPAP ventilation quite well, with a good respiratory rate and no increased work of breathing. You can adjust the rise time, which is the rate of airflow. This can be adjusted anywhere from a low of 0.05 seconds, which is shown here, up to 0.4 seconds, and adjusted for patient comfort. We're now increasing the inspiratory positive airway pressure to 13 centimeters of water and the expiratory positive airway pressure to 7 centimeters of water. The EPAP is similar to the PEEP, or positive end expiratory pressure, in a ventilator and keeps the alveoli open. Alarms are set on the machine with a low pressure alarm if the tubing becomes disconnected.
Alarm.
You can also set a high pressure alarm to detect if the tubing becomes obstructed, an apnea alarm, a minute ventilation alarm if the minute ventilation drops below a certain level, and a respiratory rate alarm if the respiratory rate is too high or too low.